Hello and welcome to Lyra Nara. In today's video we're going to talk about tinnitus, a condition that affects many and where the causes are very misunderstood often. So therefore in this video we're gonna explain the real causes of tinnitus, what is happening in your brain, in your ear, etc., what causes tinnitus, and of course tell you what you can do about it. So, without further ado, let's dive right in and learn more about tinnitus. So let's start by talking about what many consider to be the main causes of tinnitus. So it might be caused by exposure to loud noises, it might be a side effect of medications, ear or head injuries, diseases of the ear infections, emotional stress, hearing impairments, or just simply the aging process. And tinnitus is a perception, so a sensation of noises, a ringing in the ears or in your head. But the interesting fact is that the tinnitus sound is not generated in your ears, it is actually generated in your brain. Neuronal disruptions induce an abnormal activity in the so-called keyboard cortex, and the neurons start to fire spontaneously, generating specific signals, which are those tinnitus sounds. And due to the possible interactions at the neuronal level between the sensory auditory cortex, where the tinnitus is controlled from, different emotions and stress or distractions, not being able to concentrate, being depressed, tired, nervous, or just simply anxiety, can occur as side effects of tinnitus. And this is neurosynchronicity. So for individuals with long-term tinnitus, one or more of the causes that we've mentioned led at some point to an auditory impairment. And the brain's attempt to compensate for this malfunction is the start of this vicious cycle. The auditory cortex is the part of the brain that is responsible for hearing, of course, and every stimulus perceived by the ear is transmitted to and processed by this auditory cortex. And the nerve cell assemblies in a specific area of the auditory cortex are tuned, so to speak, to a certain frequency, similar to the arrangement of the keys on a piano. And no matter what trigger may be responsible for the tinnitus, whether it is noise or medications or stress, they all lead to an interruption of the signal transmission from the ear to the auditory cortex. And this means that some of your nerve cell assemblies no longer receive signals. And to stay with the piano image, some of the piano's keys no longer work and cannot be struck by the pianist. However, these nerve cell assemblies do not react to the lack of stimulus by simply remaining silent. Instead, the nerve cells begin to chatter spontaneously and become synchronously attuned to one another. And once they have become hyperactive and synchronous in this way, the nerve cells simulate a tone that the brain hears, and this is the tinnitus tone. And coming back to the piano example, the broken keys have created their own permanent tone, so to speak, even without the keys being struck by the pianist. And over time, this pattern strengthens and the tinnitus becomes permanently anchored, and thus the brain has learned this phantom sound. In order to better understand the real tinnitus causes, we also have to look at the anatomy and physiology of the ear and the auditory channel. So, the cochlea is a spiral-shaped cavity in your inner ear. It is the sensory organ of hearing, as you can see also from the images here. And the cochlea receives the sound waves from the outer ear through the auditory canal and converts them into electrical impulses that are transmitted to the brain via the auditory nerve. The auditory nerve, or vestibulocochlear nerve, is divided into the vestibular branch, concerned with balance and motion, and a cochlear division that is responsible for hearing. The cochlea originates from the ectoderm and is controlled from the postsensory cortex, which is part of the cerebral cortex in your brain, as you can see from the picture on the bottom right. And the cochlea in the right ear is controlled from the left side of the cortex, and the cochlea in the left ear is controlled from the right cortical hemisphere. Hence, there is a crossover correlation from the brain to your ears. The cochlea also shares the control relays with the vestibular organ, and therefore many times the tinnitus, the vertigo and hearing impairments are interconnected, although the psychoemotional triggers for those conditions are different. And with that understanding, let's come to the real causes of tinnitus, which is a shocking psychoemotional conflict that is linked to the cochlea of your inner ear. And this conflict is expressed in the sensation that I don't want to hear this anymore, or I can't believe what I just heard. Noises such as permanent dog barking, a screaming child, construction noises like jackhammers and chainsaws and generators, persistent traffic noise, so loud trucks, sirens from ambulances, fire engines, police cars, noisy neighbors, lawnmowers, grass trimmers, loud or annoying music, the nagging voice of a person, or something upsetting that has been said are examples of what might trigger this type of conflict and therefore the tinnitus. And often hearing conflicts occur also on the phone. Musicians and music lovers with very fine ears can also suffer a hearing conflict during a poor musical performance. And for someone who is noise sensitive, the smallest noise can cause ear-related distress. And during the conflict active phase, there is a functional loss of the cochlear branch of the vestibulo-cochlear nerve that results in the perception of sounds in one or both ears without an external source. And this condition is of course called tinnitus, and it is different from hyperacusis that is caused by a noise conflict that is linked to the stapedius muscle. The cochlea belongs to the group of organs that responds to a very specific psychoemotional trigger with a functional loss, similar to the vestibular organ, olfactory nerves, your retina, and vitreous body of the eyes, the eyelid cells of the pancreas, and the skeletal muscles. And the ringing, buzzing, humming, or whistling, or clicking, or tinkling, or hissing, or roaring noise, there are sound frequencies that are associated with this hearing conflict. And the biological purpose of the tinnitus is to be a warning signal that tells you the last time you heard this, you were in danger, upset, you were concerned, so watch out. And this explains the variety of sounds heard by people with tinnitus. Depending on the magnitude of the conflict, the sounds can be mild and only noticeable in a quiet room, or they can become extremely loud, causing difficulties hearing external sounds even. And a person might also hear complete sounds or noises such as engine noise or the ringing of a telephone or a musical tone, which is also called music tinnitus, or a recurring sentence or word, which is called word tinnitus. And if the tinnitus is present all the time, this indicates that the conflict has not been resolved yet. And this is not just a theory, as you can see here from some CTs. This auditory cortex response can be noticed even on the CT. Let's also talk about the auditory limbic system dysregulation. So tinnitus can be a phantom sensation that depends on three factors: on the eventual peripheral auditory lesions, on the central auditory reorganization, or on the non-auditory gating. And the tinnitus non-auditory factors are the ones that link tinnitus to the limbic system, and those can be that not everyone with a hearing loss gets tinnitus. Often we also see only intermittent tinnitus. It is also possible to treat tinnitus by modulating stress, emotions and sleep. And there is a comorbidity between depression and stress. And for patients with tinnitus, the shrinking region caused by the unpleasant sounds can be measured using MRI techniques, as you can see from these pictures. The nucleus accumbens, in charge of pleasure and well-being sensations, is trying to modulate and regulate these sensations. And therefore we can conclude that people with tinnitus had a stressful, emotionally dysregulating event in their life. The ones that we've mentioned already, the sensation that I cannot hear this anymore, I can't believe what I just heard. So we can really say that the tinnitus is a failure to tune out that unpleasant noise. Therefore, there is a compensated tinnitus when you can tune it out, and there is the tinnitus where you cannot tune this out anymore. And here in this graph, you can see the interaction between your auditory cortex and your brain. Let's also talk a little bit about Down syndrome and why you will see in a second. Because the brain relays of the inner ear are located right underneath the control centers of the coronary arteries, which are assigned to a territorial loss conflict for a male, and to coronary veins, which are assigned to a sexual conflict for a female. And hence the hearing conflict, that I don't want to hear this, involving the COCHLEA, can also have a territorial or sexual aspect. The voice of a predator or rival in the territory, the voices of arguing people in the house, the voice of a sexual abuser, hearing the parents having sex, hearing that one sexual mate was unfaithful, etc. And the same applies to the vestibular organ. And when both hearing conflicts are associated with sounds and noises, the person will develop a double sound tinnitus affecting both ears. And if one of the two conflicts or both were triggered by a person's voice or voices, this leads to hearing voices, which is also called a hearing constellation. And conventional medicine considers hearing voices to be a mental disorder called paranoid schizophrenia. It is instead a double tinnitus, with the difference that instead of hearing one or more sounds, a person hears one or more voices. And traumatic hearing conflicts can result in severe auditory delusions. And when it comes to Down syndrome, Dr. Hammer made a groundbreaking discovery that Down syndrome is not, as assumed, caused by trisomy 21, which is a third chromosome attached to the 21st gene pair, or mosaicism. It is a double sound hearing conflict that has occurred within the first 3 months of pregnancy. Trisomy 21 can happen before conceiving, in the egg or in the sperm, and yet there are children who have a trisomy 21 without the symptoms and characteristic features of Down syndrome, and therefore Down syndrome might be treatable. There is also a condition called hyperacusis that is often confused with tinnitus, so let's explain also hyperacusis and what causes that. So the middle ear contains 3 tiny bones called the malleus, the incus and the stapes, and they carry the sound received from the auditory canal to the inner ear. And the stapedius muscle that is attached to the stapes is fundamental in reducing sound transmission. Under normal circumstances, the stapedius is relaxed and allows sounds from the external environment to be perceived with clarity. However, when a sudden intense noise reaches the ear, the muscle contracts in order to reduce the sound to protect the inner ear from damages. And the stapedius muscle consists of striated muscles. And the psycho-emotional conflict linked to hyperacusis is manifested with contractions, spasms, even paralysis of this stapedius muscle. According to its function, it is an unbearable noise such as loud bangs, blasts, explosions, shots, blaring sirens, music with very high decibel levels, a very sharp cry, a piercing scream, and the like. And during the conflict active phase, there is a cell loss of the stapedius muscle tissue, necrosis, that is controlled from the cerebral medulla. and this is proportional to the degree of the conflict activity. And an increasing paralysis of the stapedius muscle that is controlled from the motor cortex causes hyperacusis with a decreased sound tolerance, while normal sounds are perceived as very loud. And during the healing phase, the stapedius muscle is reconstructed, so the cells replenish, and a healing crisis manifests with the stapedium muscle spasms, which are equivalent to a focal seizure, and this creates a painful fluttering sensation in the ear. And finally, when the healing has happened, the function of the stapedius returns back to normal, as so far the initial noises, of course, were eliminated. And often tinnitus comes also with vertigo. So let's talk about vertigo as well and the real causes of vertigo. The vestibular system in charge of maintaining the body balance is the region of the inner ear where the semicircular canals join the cochlea. And it is this part of the ear that regulates the sensation of balance when you are in motion. The vestibular organ is controlled from the postsensory cortex. And the vestibular organ in the right ear is controlled from the left side of the cortex, and the vestibular organ in the left ear is controlled from the right cortical hemisphere. And hence, there is a crossover correlation from the brain to the organ. And the vestibular organ shares the control relays with the cochlea that we've discussed already. According to its function, the biological conflict linked to vertigo is a balance conflict, more precisely a falling down conflict. So any accidental fall in sports, at work, falling down the stairs, slipping on a wet or icy surface, a fall from a ladder or tripping over a cable could trigger this type of a conflict. Certain professions, such as builders, construction workers, roofers, infants, and the elderly, are of course more at risk. People with ALS or MS who have difficulties balancing often live in fear of falling, and the same holds true for epileptics. The conflict also relates to seeing someone else falling or collapse, witnessing someone having a stroke or a heart attack, or hearing that a loved one fell or dropped dead. In a transposed sense, the conflict could be experienced as a fall from grace or as feeling dumped, let's say after a separation, for example. And during the conflict active phase, the functional loss of the vestibular branch of the vestibulo-cochlea nerve results in a loss of balance, and this condition is of course called vertigo. And the symptoms of vertigo is a sensation of spinning or swaying or falling to one side. The vertigo spins should not be confused, by the way, with light-headed dizziness. And whether the tendency is to fall to the right or to the left is determined by a person's handedness, and whether the conflict is a mother-child or a partner-related one. Hence, if a right-handed person has a mother-related conflict, a falling conflict in this case, of course, there is a tendency to fall or spin to the left, and that is towards the mother. If the conflict is partner-related, the tendency is to fall or spin to the right, and that is towards the partner. For left-handers, it is, of course, reversed. And if the conflict concerns yourself, the falling or spinning always tends to be to the side which relates to the original conflict. For example, if the fall was to the left, the specific vertigo symptom is also a sensation of spinning or falling to the left. And of course, as with any psycho-emotional conflict, there is this conflict active phase that we've discussed with vertigo as well, and then there is the healing phase. And the brain relays of the inner ear are located right underneath the control centers of the coronary arteries, showing for a male a territorial conflict or fight conflict, and of coronary veins linked to a female sexual conflict. Hence, the falling conflict involving the vestibular organ can also have a territorial or sexual aspect, such as feeling abandoned, forgotten, or neglected by a partner. And the same applies to the cochlea. Whether the conflict is experienced in a male or female fashion is determined by a person's gender, of course, but also laterality and hormonal status. The healing phase. So during the healing phase, the vertigo intensity diminishes, and the healing crisis manifests as a sudden vertigo fit, potentially with severe nausea and vomiting. And the extent of the crisis symptoms is determined by the intensity and the duration of the conflict active phase. Recurring vertigo attacks are triggered by setting on a track that was established when the original falling conflict occurred. And alcohol, for example, could be such a track. If the falling conflicts affect the vestibular organ of both ears, this causes a vertigo constellation, and the symptoms are a wide-based and unsteady stance and gait with the reeling or lurching movements. The medical term for this condition is Friedreich's ataxia. The physical incoordination and clumsiness is not a result of muscle weakness, but is due to the unbalanced equilibrium caused by the double vertigo. And since infants and the elderly are more likely to suffer falling conflicts, ataxia develops more often in childhood and in later life. Meniere's disease, also known as primary endolymphatic hydrops, is, according to conventional medicine, quote, an inner ear disorder that affects balance and hearing, end quote. And this condition is actually a conflict combination of a falling conflict involving the vestibular organ and a hearing conflict involving the cochlea. We also need to talk about hearing loss, because during the healing phase of the tinnitus, the volume of the tinnitus sound decreases. However, the swelling created by the fluid accumulation in the inner ear, so the edema, may cause hearing impairments or loss of the frequencies of the tinnitus sound, or a hearing loss in the affected ear. And the normal hearing loss is actually happening in the middle ear, not in the inner ear. And once the edema has been expelled, the hearing ability slowly returns to normal, so no worries, provided there are of course no conflict relapses. Triggers that can reactivate the original conflict may be the order of the messenger or a visual track like the site of the acoustic source. And with the hanging healing, the tissue in the inner ear eventually wears out, leading in the long run to deafness. And this is why it is important to identify and resolve the original conflict as soon as possible. Hearing difficulties often trigger a self-devaluation conflict also because of not being able to hear well. And this self-devaluation always affects the small bones malleus, incus and stapes in your middle ear, which can result in a permanent hearing loss or otosclerosis. Using a hearing aid while the inner ear undergoes healing can also have a highly encouraging effect. And the CT on the right, the scan shows an edematous in the hearing relay on the left side of the cerebral cortex. Hence, the hearing impairment is in the right ear. And the yellow arrow points to an edema in the control center of the transverse colon, so in the brainstem. The related indigestible morsel conflict most likely occur together with the hearing conflict for a right-handed person that is related to a partner in this case. And with all this better understanding of the real causes of tinnitus, vertigo, hearing loss, etc., let's tell you what you can do about the tinnitus, which therapies work. And the real therapy, you might have gathered it already from what we've discussed so far of tinnitus, is to solve the original psycho-emotional conflict. For that you can use anti-stress therapy, combined of course, if you wish so, with antidepressants and anti-anxiety medications, even though I do not highly recommend those types of medications, but whatever helps you. And this will address the side effects of the tinnitus. However, without a real biological conflict resolution, you will never experience complete healing. Another method is hypnotherapy with tinnitus conflict regression. This therapy is one of the most elegant ways of finding and solving the tinnitus psycho-emotional trigger. And this is the real way of healing tinnitus. Again, go to the source and resolve the underlying conflict. And you can check our website for the emotional release services that we offer to start healing your tinnitus. Link in the description box below, of course. Other therapies which are only palliative treatments. So you can use, for example, masking therapy. This is a method that covers the major noises with external noises. So you wear a tinnitus device which generates new sounds that cover and fade out the tinnitus sound. And there is also what is called habituation therapy, that adds a broadband white noise to retrain, the auditory pathways, so the keyboard in the brain, with the aim of avoiding the emotional negative effects of tinnitus. So you wear a small Walkman-like device or a noise generator, and the distinction between tinnitus and the therapeutic noises becomes smaller and smaller with this therapy. It does not work for deaf people and very slowly for people with hyperacusis and hearing losses. And with all that being said, I hope that you've enjoyed this presentation. If you did so, please do not forget to like, share and subscribe, and also hit the notification button. If you have any questions, do not hesitate to contact us, shop@lyranara.com. I'm also going to post the complete contact info, including our toll-free phone numbers, in the description box below for you. And until next time, stay healthy.